Hey everyone, this is Victor Abafe with A Healthier Democracy, and today I want to talk about the Ethics in Patient Referral Act, better known as the Stark Law. This law was passed as part of the Budget Reconciliation Act of 1989 in response to several research studies which supported the idea that doctors were referring patients to care sites where they had a financial interest in, either via direct ownership or payments they received. When the Stark Law was first passed, it outlawed doctors from referring Medicare or Medicaid patients to clinical labs in which they or an immediate family member had a financial relationship with. The law was subsequently expanded and adjusted in 1993 to include other designated health services, which include inpatient and outpatient hospital services, outpatient prescription drugs, home health services, various forms of imaging, clinical labs, and physical therapy. Four types of financial relationships with a referral site would trigger the Stark Law, including direct ownership, indirect ownership, direct compensation, and indirect compensation. Although there are a few exceptions granted, including for implants put in place in ambulatory surgical centers, preventative screenings, and EPO treatment for those with kidney disease, this law is a strict liability law. Any technical violation, regardless of intent, can lead to severe financial penalties, lack of being able to engage in federal healthcare programs, and denial of Medicare payment. The upside of this law is that it helps ensure referral decisions by doctors are solely based on clinical need and not financial conflict of interest. As medicine has shifted away from fee-for-service and more towards a value-based care environment, this law has served as a barrier for independent practices to engage in these new payment models. In addition, it can potentially limit care access for patients who have complex care needs or for those who are in underserved areas with limited care options. A few ideas for reform include addressing disparities between restrictions on doctors and medical corporate entities, modernizing the law for value-based care arrangements, or modifying the strict liability aspect to account for good faith efforts at compliance. As we think about the laws and how they impact a physician's ability to guide care delivery, the Stark Law is a very important law to think about.